Welcome and thank you for taking the time to join us here today. And I'm Stuart Smith of smallcapboys.com. And today we're going to be speaking to Mitesco Incorporated. They're traded on the OTCQB under the ticker symbol MITI, as well as members of the management team and board of directors for both Mitesco and the Good Clinic. Let me start right now with the big question. Is Mitesco and its business model, along with the Good Clinic and its business model, is this the right business at the right time with the backdrop of coming out of a global pandemic?
The short answer is I wouldn't be here if I didn't think that was true, right? I've been working in healthcare for so long. There's some things that we've learned over a period of time. There's so much incumbent momentum in the way the system works. Yeah, it's very timely. We know that there's a significant shortage of primary care. If you interview a patient, they tell you all the symptoms of a system that's not supporting either the patient or the provider. And that's not an accusation or a criticism of the existing providers. It's just its old infrastructure.
I would say that they were well poised for growth and success pre-COVID. I think that the healthcare crisis has and will leapfrog telehealth, generally speaking, but this cannot escape all of us because these are based on personal experiences. For testing, for checkups, for different procedures, you still have to go to a physical place. That's where the Good Clinic comes in, blending convenience, technology, and cost efficiencies.
I think the strategy is right on point. The millennials view healthcare differently, and I think they're going to be the ones that change access and the cost curve in healthcare. I also believe that virtual as well as brick and mortar is also the right strategy. The success they're having in negotiating with payers also validates this strategy. Healthcare is evolutionary, it's not revolutionary. COVID probably sped up the use of virtual and nurse practitioners by, a solid 6 to 7 years.
Obviously, with what you just said about being the right business at the right time, this is a great investment opportunity as well, I would have to believe. What's your take on that?
I totally agree. I think when we focused and we were able to attract the Minute Clinic senior management team to come over here, take their experience, and help us build out a new model focused on nurse practitioners, we get the benefit of what they did with the Minute Clinic. We also get the benefit of the way that we've changed the ability in the United States for nurse practitioners to provide care as a primary care provider. So this opportunity to expand primary care in the United States through Mitesco is the right time and the right place.
Your plan for the company is to expand it regionally first in your area there in the Midwest, upper Midwest, and then branching out from there. Is that a fair assessment?
Yes, actually, the first clinics are being set up in Minnesota, but we are then identified 3 other beachheads. So we are also have 9 sites under negotiation in the Denver market. We'll be looking to move on from there to Arizona and then also Florida, creating the first kind of establishment of the brand and then growing from there. So we really are looking to go to a national concept with 50 clinics, new clinics built by 2023 in those 4 markets.
Technology is a big part of the telehealth, telemedicine, digital health, digital medicine platform, which again, the Good Clinic is going to be leveraging. Talk to me a little bit about where you see technology assisting this company, the Good Clinic and Mitesco, going forward.
Well, for one, I think the ability to access multiple records and present that to the Good Clinic is really the optimal way and the number one technology that the Good Clinic will implement.
One of the things that many of the people watching this may think, well, telehealth is nothing new. It's been around 20, 25 years. If there was one good thing that came out of COVID, it was an appreciation for the value and capability of virtual care. But most organizations have it as an adjunct. We are building our clinics from the ground up based on technology, telehealth being one of them. So every consult room, every exam room has the capability to provide either the physical visit or the virtual visit in the same footprint. The second piece is really leveraging technology online to make the experience better, to give consumers a better access to their medical records, to appointment setting, to communication with the provider. Everything that a consumer is looking for in their e-experience dealing with organizations is being built into the Good Clinic as well.
Larry, the CEO, and I were involved with a telehealth company back in 2004. We were ahead of our time. It was called American Telecare. They had the first stethoscope that went up with the space program in NASA. And we were too early. There wasn't the reimbursement at that time. We went into seniors' homes and they just loved it. They had some technology issues at the time, but at this juncture in 2021, those bugs are worked out. The telehealth programs, the ability to have the right equipment in the home to be able to help the senior and or on the other side of the house, just in our normal community care. It's there, and we're going to provide that to our members and to our group as we expand throughout the country.
Technology gives us the opportunity to be able to engage with our patients more than when they're in the building. I mean, you think about the service of getting medical care, we tend to think about that moment when the provider and the patient are face to face. Well, I'm not making those decisions that impact that when I'm sitting in the clinic. I'm doing those when I'm at home. And that's where technology really plays an important role. So it doesn't always have to center around every interaction needing to be a face to face. Talking clinically, it's also the operational stuff. If you look at traditionally how primary care has been, it feels old. It's not the way that most patients or most consumers are expecting to have their service. Technology really is about reducing the friction to getting the service and satisfying the answer for the patient when they need it.
So I'm going to follow up with one more question along that line. We've seen a spotlight on people not being able to receive timely and quality care through, again, this global pandemic. Look, these things happened before the pandemic. It's just a spotlight was put on it. Changing roles here from business to more philosophically speaking, is Mitesco providing a societal good as well?
There's no doubt. You know, the fact that, again, allowing us to have more access to get care prior to becoming a systemic problem that ultimately ends somebody up in the hospital, we're able to provide care early on. And people are comfortable to be able to, again, go down to the bottom of their condominium with a clinic there, or across the street, or down in the bike path in their community to get care with somebody they trust, they build a relationship with, and most importantly, they're willing to go to early on when they have a potential situation that can be solved before it ends them into a more emergency room or some other kind of a long-term care situation.
For those of us that were attracted to healthcare in the first place, part of what attracted us is how critical it is in people's lives. This is something that people can't go without, or if they can only do so for a limited period of time. And the consequences for some people can be quite serious. You know, we talked a little bit earlier about COVID and the impacts of the pandemic. The pandemic has shined a very bright light on the idea of equity in healthcare. And one of the best tools that we have to approach the equity question is access to quality primary care. Every dollar that you spend in primary care saves $13 in the overall cost of care in the system. And the more accessible we are, and the easier it is for people to get the answers that they need, the more that we are able to reduce the impacts of and the burdens of health equity issues.
I believe that it works well. Younger people, younger patients can come in and have it utilized because they're used to doing everything on an app. But you know, more contemporary patients or senior citizens may or may not want to use all the elements of technology. So we'll take care of those things at the physical location of the Good Clinic. It's a way of reintroducing your neighborhood physician, and I think that's something to be promoted and encouraged throughout the nation.
Yes, I believe it is. And, you know, we can go back to our discussion of the primary care access problem and look at that through the lens of the importance of primary care and a longitudinal relationship. But now we want to enhance it even further in that we want to provide not just the expertise of healthcare, which we will, but we also want to provide the empathy of the provider. Engage the patient. We're not talking about sick care. We want to take it from sick care into a partnership between the provider and the patient. so that the patient gets the time they want to ask questions, to clarify what's going on, to express concerns. We want the patient to understand also through education how they can make better lifestyle choices to get the most out of healthcare and improve their quality of life. So in terms of the investment we're making, yes, we think we're going to add a significant value to the American society and to the quality of the healthcare system by redefining primary care from an access perspective as well as a breadth of perspective. So we'll be adding behavioral health. We'll be adding some dermatology services. We'll be adding things like nutrition training and dietitians, and help the consumer understand how to get the most out of the relationship and their time with a good clinic.